So the bad news is we have more data coming out about the coronavirus's impact on people. And there was a crazy article written. I think I read it in Fox, but it's been reported in multiple locations about the impact of coronavirus on male fertility.
Mm.
Now, a couple of weeks ago, I mean, it was months ago, there was some data that came out, Shannon, that went over a bunch of people's heads about how the coronavirus could be transmitted sexually because they had detected it within sperm.
Oh,
You didn't know that?
wow. No.
Yeah, so that was data that came out, and I remember reading it and saying, "Wow, this is a game changer because now even sex
Yeah,
is
it
off
is.
the table.
Yeah.
It's an actual STD, and it's an STD now." So that came out first. Then, now that we have this coming out about male fertility, it takes things to a totally different level because no one's talking about the fact that you can get this thing, live, but still be dealing with the after effects for years to come. It's one of the points
Yeah.
that the media never makes. They just talk about cases, deaths. They don't talk about the in between, which is you live with this thing, but it strips away parts of you that you were never told it could strip you from. Male fertility, I think, is a pretty big one.
Yeah, definitely. Male fertility. Yeah, that is kind of, yeah. And we had talked about this on a past podcast that, the after effects are definitely something that they're more important right now the deaths are important too, but because more people get the virus than die from the virus, it's
Yes.
definitely something that we should be focusing on.
So I have the article here. I want to read a piece of it. It was Fox where I read it. It says researchers from the University of Miami Miller School of Medicine found that COVID-19 could impact male fertility. In a study published in the World Journal of Men's Health, researchers found that COVID-19 can invade testes tissue in some men who are infected with the virus. The belief that COVID-19 could enter the male reproductive organs may indicate that the virus could be transmitted sexually, according to the study's lead author, Dr. Wow. I don't want to offend Indian people. His name is, I'm saying it's Dr. Ranjesh Masama. I
Nice.
apologize
Okay.
to all Indian people. I
Nice
just done
try.
on purpose. Associate professor and director of reproductive urology at the Miller School. Researchers analyzed testes tissue from the autopsies of 6 men who died of COVID-19. They found impaired sperm function in 3 of the men and evidence of COVID-19 that had entered the male reproductive organs. So that is interesting.
Yeah.
And so it impaired sperm function.
That's crazy. So, I mean, I don't even know what to really say about that. If you needed a reason, I feel like this is a wake-up call for all the masculine men who didn't believe in wearing masks. Maybe you should now, so that your manhood isn't affected by the
Yes. And by the way, you guys should all read this article. Later on in the article, it goes on to pretty much say that there was a guy, Shannon, who he went to the doctor for infertility issues, but he knew that he had previously had COVID-19, but he was asymptomatic for having it, tested negative as well, and he still had and they still found presence of the virus inside the testes. And so they said that was the first published research to report on the case of a live patient to demonstrate the presence of COVID-19 in testy tissue.
So it lingers there even after it's passed out of your system for the most part? It just lingers?
Well, I don't know exactly because it's saying that he went to the doctor because of infertility issues. So they did a biopsy on his testes. And he had a previous history of COVID-19. And according to this article, it still showed the presence of the virus in the testes. So even after he had recovered from the virus, he still had the presence of the virus in the testes. Now, just for clarification for the audience, they don't understand that there's a difference between the virus being detectable and the virus being a live virus. So the live virus is what gets you sick, right?
Mm-hmm.
That's what, I cough, Shannon inhales, she gets sick.
Yep.
But you also shed dead viruses as well.
Mm.
The dead virus, your body sheds usually days and weeks after you have recovered from the virus. And so people can't really get sick from that virus, but it is going to be detectable in your system.
Yeah.
And so what this is showing is that, yeah, it was still detectable in his testes, even after he recovered. And now he can't be getting anybody pregnant.
Wow. Is that permanent fertility issues, or is that like something that can be fixed over time? Did it say that?
It doesn't say that in the article. I mean, fixing male infertility is kind of a hit or miss issue, because usually for men who are infertile, it's usually like a sperm production problem where you're not producing the amount of sperm that the average man should be producing.
Wow, guys.
So
I
have no idea.
Think about that before you go to a party this weekend. I don't know.